Good day, I'm RYANT, DAYRIT, student nurse from Mount Carmel, and today I will be performing a return demonstration in the assessment of the head, neck, eyes, ears, nose, and tongue. So performing these procedures, you need to perform proper hand hygiene and put on PPE, and after this, we can now proceed to the assessment. Good day, sir. I'm Kobe, your student nurse for today. May I know your name, age, and birthday?
I'm Jariel Blackson and I'm 16 years old. My birthday is August 13, 2006.
So first, we have to identify our patient to ensure we have the right patients.
You can call me Jack for sure.
Okay, sir, I'm here to perform an assessment on your head, neck, eyes, nose, and tongue to ensure everything is normal, and if there are abnormalities, we will take note on that and refer it to the experts. Position the client appropriately. So we will close the curtains to ensure the patient's privacy. Instruct the patient to drape himself appropriately. Make sure environment is with adequate light and room temperature is regulated. Wash hands or sanitize your hands with alcohol. Hello sir, how are you today?
I'm good.
Have you noticed any changes in your head? Any discomfort? Do you experience headaches in the past few days, sir?
No.
Inspect the person's head for size and shape and palpate temporal area. Inspect facial structures. Observe person's ability to move around the room and note facial expression. Inspection of external ocular structures. Inspect eyebrows for symmetry and movement. So, sir, can you move your eyebrows? Yes, stop. Next, we will inspect the eyelids, lid margins for swelling, discharge color, scaling, and erythema. Next, inspect eyelashes for hair distribution along the lid margins. So, sir, can you look down? Yes, sige. So, next we will inspect for conjunctiva and sclera for color. Next, we will inspect for lacrimal apparatus for swelling and tenderness. Inspect anterior eyeball structures. Next, we will inspect cornea and lens for smoothness and clarity and test for cornea reflex. Next, we will inspect iris and pupil for size, shape, and equality. Test central visual acuity. Next, we will test for visual fields. Next, we will inspect for the size, shape, skin conditions, and tenderness. So next, we will inspect for the external auditory meatus for swelling, redness, or discharge. Next, we will inspect for the external canal for redness and swelling, lesions, foreign bodies, or discharge. So next, we will test for the hearing acuity. Sir, can you cover your ears and repeat the numbers? 5,
5,
4,
4,
2,
2,
1.
1.
So the patient got 4 out of 4 on his hearing acuity test. Palpate auricle for pain sensation on movement, and palpate mastoid area behind ear for tenderness. Inspect external nose for deformity, asymmetry, inflammation, or presence of skin lesions. Next, we will test for the patency of the nostrils. Next, we will test for olfactory nerve. So next, we will inspect the nasal mucosa for swelling, discharge, bleeding, or foreign body. Next, we will inspect the nasal septum for deviation, perforation, or bleeding. Next, we will palpate the sinus areas. Next, we will inspect for the lips for color, moisture, or cracking, or lesions. Next, we will inspect teeth and gums. Inspect the tongue and check for color, surface, characteristic, and moisture. Inspect the buccal mucosa for color, nodules, or lesions. Inspect palate for color and mobility. Inspect the throat and note for shape, surface, characteristic of tonsils behind the anterior tonsillar pillar. Inspect the neck for symmetry and range of motion in active motion. And next, test muscle strength. Inspect thyroid gland for size and visible mass. Inspect external jugular vein. Palpate lymph nodes. Palpate thyroid gland and palpate trachea for tracheal shift. After doing the assessment, we will now document all the findings.